Hello, welcome to Dr. Carri's Clinical Corner. Today, I want to talk about should men do Kegels? And my answer is for the vast majority of them, no, it's not necessary. The only time in my practice that I see men who need to do Kegels is after prostate surgery. So sometimes with prostate surgery, there's a disruption to the nerves of the bladder too, and there's bladder leakage. Those guys, they need to do Kegels. But if you don't have that problem, generally not Kegels. So my men with erectile dysfunction, generally not Kegels. Erectile dysfunction is probably a blood flow issue. Most likely it's an early sign of heart disease, so get checked out. But if there's a muscle component, a pelvic floor muscle component, the muscles are probably too tight and the blood can't enter the penis. So those guys don't need to do Kegels. If you have tight pelvic floor muscles, you don't need to do Kegels. We need to work on relaxing. And if you don't have any issues, then there's no reason to do Kegels. So our pelvic floor muscles, our Kegel muscles, are part of our core. So they should just work automatically. So every time we exercise, every time we move, every time we take a step, they engage automatically. So they are getting exercised throughout the day. So I don't think Kegels are going to enhance your erection, your ejaculation, your penis length. I don't think there's any evidence of that. Because they're getting exercised automatically. So unless you've had prostate surgery or you have bladder leakage, but again, even my men that have other bladder issues like a slow urine stream, that's usually from tightness. So again, often it's back to the prostate, but if it's muscle tightness squeezing the urethra, and it's not weakness. So yeah, really the only time I can think of men that need to do Kegels is after prostate surgery or bladder leakage. But everyone else, either their pelvic floor muscles are working fine or they have tightness is what I see clinically. And I don't think there's any evidence to say increasing your pelvic floor muscle strength is going to increase erections or ejaculation or penile size. I haven't seen any evidence of that. So, men, you don't need to do Kegels. All right, talk to you next time.